Heavy legs, ankle swelling, bulging veins, or those little spider veins that keep showing up. Today, you're going to learn what your legs are actually trying to tell you, when it's a cosmetic issue and when there's a health issue, and what modern vein treatments really look like now. So stay tuned to the end, and you're going to learn 5 things you can do this week to love your legs again. Now, if this helps, follow The Advisor with Stacey Chillemi on Apple and Spotify, and subscribe on YouTube to at Stacey Chillemi Advisor. It helps more people get real health info. Now, today I'm really excited because we have a very special guest with us. Today I have Dr. Tony Reinke, and an interventional radiologist, solo minority
Yes.
practice owner, and an educator who empowers patients to understand their vein health. It's so nice to have you here. Welcome to the show, Tony. I'm really happy. Tell everybody a little about yourself and what you do.
Okay. Thank you for having me. I am an interventional radiologist. I practice in Houston or just a suburb right outside of Houston. Been doing that for the last 12 years. I treat 100% leg vein disease. So that can encompass many, different kinds of symptoms. And formerly, just as a caveat, something about me is I was a surgical ICU nurse. Started out, went back to school, became a physician assistant. I worked in neurosurgery, and then I went back to medical school. So if you add all that up, it's 18 years of training.
That's a lot of training.
It's a lot of training, and I have no regrets. I'm very happy with kind of the course. It needed to be that way, but I love what I do.
Well, you know what? The more education you have, the better. I feel that, it broadens our knowledge and our wisdom, especially in the medical field itself. Now, let's start where people really are. If someone has heavy, tired, or swollen legs, what could that actually mean?
Well, I'm biased, so if they're coming to me, I'm going to do a thorough history physical examination. To answer your question, it could be that their veins are stretched out, valves inside the veins don't close anymore, and blood is backing up. What
Mm,
else could it be? Because not everything 100% necessarily with those symptoms is vein disease. So maybe it's a factor, a side effect of their work environment. They sit or stand a lot. Maybe it's related to changes in their weight, especially an increase in weight, side effects of medication, sedentary lifestyle. There's other medical diagnoses that it could also be related to. So my job is to sort through that, evaluate a patient, and then based on what I'm hearing, either tell them, no, I don't think this is a vein issue, or yes, indeed, I do. Would you like to proceed with the next step, which is evaluation via an ultrasound?
okay. Now, what are the most common vein problems that you see in your practice, and what usually causes them?
The most common, I would say, symptom related to vein disease is swelling.
Mm,
Again, like you had just said, there's so many things that can cause swelling, basically everything that I just named.
yeah.
Um, so I would say swelling's the most common thing I see. Then heaviness, aching, tired, those all kind of go together. But then there's some symptoms that people don't really think about, like night cramps or
Mm,
restless legs that also, they're not specific to vein disease. They can be two separate entities, but sometimes there's overlap. So
okay. Because a lot of people sometimes, they think veins are just cosmetic in your world, but it's really not. So when you get those symptoms that you just mentioned, it could actually be a health condition or even a serious health condition.
I think if I were a patient and I was trying to sort through, is this just cosmetic or is there medical? The first thing I would do, it's super simple. Bullet point is this. If you have symptoms, it's medical. If you don't, all that's wrong with your legs or all that concerns you, I should say, about your legs is how they look and you don't have any symptoms, that's cosmetic. Bottom
Okay.
line. Hmm.
That makes it very simple.
Yeah.
Now, who's at risk? Like standing jobs, like pregnancies, weight, genetics,
Yes. So I would, the number one risk factor for vein disease is genetic. If
Mm,
one of your parents has vein disease, you have a 50% chance. If both of them do, it goes all the way up to 90. So number one risk factor is genetics. Then if you add on obesity, the
yeah.
pressure in the abdomen as you increase weight gives additional pressure on already stretched out veins, causing more backward blood flow. So, obesity, an occupation where you're sitting a lot or you're standing a lot. And that's because of gravity. So, you have stretched out veins, blood's already going towards your ankles instead of towards your heart. And then gravity keeps pulling at that blood. So, occupation where you sit or stand a lot. For females, you did mention pregnancy, and it's the change in hormones. So, not
Oh,
just being pregnant, but as a female, we're at a little increased risk because estrogen and progesterone both cause even more stretching or relaxation of already stretched
oh,
out veins. Hmm.
really?
Yeah.
Yeah, because I know after before the show we were talking and you mentioned that it was a 50% chance if your mother has it. So I'm going to cross my fingers and keep hoping that my father's DNA take, so far
Right,
so far
right.
I feel like I have my dad's DNA. So I'm just going to cross
Yes.
my mom has
Yeah.
those the varicose veins, but she got rid of them, but still I'm crossing my fingers.
I'll cross
Okay.
my fingers for you too. Yeah.
Thank
You would,
you.
I mean, honestly, you would know if you have symptoms, right? And just because you have vein disease, this is a big thing that we emphasize in my office. Just because you have it, it does not mean you have to be treated.
Right.
Um, it's a condition that you can live with. So what we do here is we have patients fill out a really abbreviated quality of life, which basically is just telling me how much do these, if you have symptoms, affect your ability to perform your daily activities. That gives me an idea if one, they actually do have symptoms. So is it medical? And two, how much does it affect or impinge upon anything that they wish they could be doing? Putting all that together with their history and physical, I can advise them.
I like that. And it's so important to get advice from a doctor and not make your own conclusions and decide because there's so many products out there. I see it all the time. They promise
Uh-huh.
this, they promise that, and the best thing to do is to go straight to a medical doctor that is an expert in that field and get medical advice, whether it's first a consultation and then you decide what you want to do or but it's always good for me. I always tell people get medical advice because a lot of times I see people go on Google and they become their own medical doctors and then they start there's all these promises, so many products out there.
Hmm.
It's like it blows your mind. And the first person you really should go to is a specialist who specializes in varicose veins and to be able to get at accurate, understanding of
Hmm.
what's going on in your body.
I completely agree with you. What I kind of take home points for patients that I always say is first, in my office, consultations, which are about 15 minutes, are
Mhm.
done by me. So you're actually seeing the physician. They are completely free. So if you call and you schedule a consultation, we're going to book that appointment for you and not plan on seeing anybody else and not charge you for that. So it doesn't get to me, it doesn't get any better than that. There's nothing better than free medical advice with no obligation.
And that's wonderful because a lot of times I will go to doctors and they charge you for the consultation. So that's amazing that you offer that.
Yeah, I think so too. I think I'm very blessed. I worked really hard, got to this point. I own the practice and I'm the only practitioner here. And so it's a privilege to me to be able to do that. That's just how I run my practice. I do. I wish personally there was more physicians that were able to or wanted to do that. So, yeah, I think it's a great perk for my patients.
I think it's a great perk. Now, people hear varicose procedure and the
Hmm.
big procedure they think is surgery. What
Yeah.
does modern vein treatment actually look like now in our current present, day?
Yeah. So what I would say to you, a little anecdote is that when I was a nurse, I told you I worked in the surgical ICU, and
Yeah,
sometimes, like 30 years ago, they used to do vein stripping procedures, which is a major surgical procedure, general
yeah,
anesthesia, and a 6 week recovery time.
yeah,
Now it's come full circle for me professionally, where I've gone from nurse, where we would sometimes recover those vein stripping patients if they were having a lot of pain or couldn't, their pain couldn't be managed, to
yeah.
now the procedures that I do are approved by insurance,
Mhm.
performed in the office. So I perform them here. Takes me less than 15 minutes from start to finish. Patients are back immediately to their normal
Wow.
activities. So there's no downtime, there's no bed rest. We need our patients up and moving, and they do so without narcotics or pain medication. Ice and Motrin is typically all they need. So it's really nice. I think, for patients knowing that, so that's part of education and outreach, is teaching people that. It's a big
Right.
difference. Mhm.
Oh, yeah. Oh, that's wonderful. Now, how long does it take? Like, what's actually the recovery like? Like, do people go back to work in a day or two? I know you just were mentioning that, but can you go a little bit more in detail?
So we have patients they go right back to work. Patients will even come in sometimes on their lunch break because, again, if I'm doing what's called, it's heating and sealing the vein, that's called radiofrequency ablation, big word for heating the vein shut. That takes me 15 minutes. They come in, I do the procedure, we wrap them up, they go walk, and they're back to work. So there is no downtime. We have, like I said, sometimes on lunch breaks, other patients will ask me, I'm a runner, I'm an avid runner. Can I get back to running? Yes, you're back to your normal activities immediately.
Wow, I love that. Now,
I know.
it's amazing,
Yeah.
because, you
Right?
know, well, there's so many things that people do, that when you go for surgery, you had to, like it took a long time to recover. And, nowadays there's a lot of procedures that they figured out ways where people can actually just go for the procedure
Hmm.
and within a very short time, go back and just continue their daily routine. And that to me, that's amazing.
It's huge. It's huge for patients, for their comfort, etc. But having these minimally invasive procedures, sometimes even having like robotic surgery where it can be much more precise. Obviously, I don't do those, but I'm just saying, yes, there's been a huge evolution in the technology in
Yeah,
medicine that allows me now to be able to work through catheters, which are like little flexible straws that I use
yeah.
to heat and seal the vein, and then boom, they're back. There's no downtime.
Oh, that's truly amazing. Now, what can people try at home first, like compression, movement, elevation, before they come to see you?
That's a great point. And what I would say is most insurance actually requires a trial period of compression hose. So if I were going to say to patients too, if you want to get ahead of the ball before you come in for your free consultation, start wearing compression hose as soon as you think about it.
Mhm.
So yes, compression hose help. Now, these are medical grade compression hose. So what they're doing is they're taking your big stretched out vein, and I tell patients it's kind of like it puts a hug on the vein, just a little support. So
Yeah,
not as much blood is pooling in those veins. It's the pooling of the blood that sets up this whole inflammatory cascade, swelling, aching, etc. So compression hose is one thing. Another thing is anytime, whether that's during the day when you're working at home or otherwise, you can elevate your legs. It could be on just a box or a step, or
yeah,
at the end of the day, putting your legs up on pillows. That's a great way to do it. Even something like ice. So if you have a lot of swelling and at the end of the day, you can put ice over your legs, do that 10 minutes every hour or something, it's going to decrease inflammation and swelling. So those are some things that patients can do. There's even herbal supplements. I can tell you that on Amazon, there's something called diosmin, which if you imagine a cycle of inflammation and swelling, that herbal supplement kind of helps to decrease that cycle of inflammation. And so I
Yeah.
have recommended that to patients. It's not something that works right away. It's not like a
Yeah.
water pill, but
Right.
over the course of maybe a week, they might see some decrease in their swelling and inflammation. Those are probably the biggest
Oh,
things. Walking is the best exercise you can do.
yeah. You hear that all the time. Some people,
Yeah.
for the longest time, people thought it was like power walking or running or jogging, but actually, it's just regular walking. If you could just walk outside for a specific amount of time,
Yes.
it's the best thing for you.
Yes. And the reason that works, whether it could be a treadmill inside, it could be swimming, when you're contracting those muscles in your legs, you're
Yeah.
forcing the blood that's just sitting there to go the correct way, which is towards your heart instead of towards your feet. So you're at least temporarily decreasing that pressure, decreasing the inflammation. And then you do
Yeah.
that for 15 to 30 minutes and you've reset that pressure. So it's good. It's good for your mental health, for your physical health, for your vein health. But it's definitely the number one exercise that I recommend for my patients.
I love that. Now, when is it time to stop, doing it yourself and see a vein specialist?
For me, what I say is if it's to the point where you're starting to modify things that you'd like to be doing or you're no longer able to do something that you want to do, I'll give you a for example. I have several of my patients who will say that because they have so much swelling and aching in their legs and in their feet, they've had to go up a couple of shoe sizes. Definitely. That's like, yes, that patient definitely should come in and just explore some options for them. But when anything that you want to be doing, cooking, cleaning, playing with the children, etc., you're not able to do because, oh, I can't do that because I have to elevate my legs. That's the
Yeah.
time. I think at least come in and get education. Again, it does not mean that you have to have procedures. In
Yeah.
our office, we're about empowering patients to make an informed decision by educating them. You can decide, even if your quality of life is being interrupted, you still don't have to have procedures. It's a
Right.
patient's decision, not mine.
That's good to know. And especially if your shoe size is getting like, one or two or three sizes bigger, I
Right.
think that's a no-brainer right there.
Right. Yes. Yeah. Obviously, more advanced changes that patients can have, sometimes for reasons, lots of reasons. But if you have a wound, that's really advanced changes. If you have an open wound, say a sore that's not healing, it's been months,
Yeah.
definitely come to see me. That could be a venous issue, it could be an arterial issue, it could be a skin infection, but
Mhm.
that would be something that's very advanced changes. And for a free consultation, I would tell a patient, this is what I think it is. But yeah, don't wait until you get a wound or a bleeding vein or God forbid a blood clot.
Right. Oh, that's good to know. Now let's
Mhm.
talk insurance. When do vein issues get covered, and when there's pain, swelling, or skin changes, is that the time where insurance companies will say, yes, we'll cover that?
In a nutshell, yes. Like if I were just bottom lining it, yes, that's what I would say. You have to have symptoms, and usually it's some kind of skin changes, whether that's swelling, darkening of your skin, or if you're fair skinned, it might be just a pink um, discoloration that starts at your ankles. So
Yeah.
changes in skin, swelling, plus symptoms. That's why it's important for us to delineate, is it cosmetic or is it medical? If it's medical, that's when they'll cover you. I think what I would want to say about insurance, certainly it's complicated. In my opinion, maybe intentionally so, but it's very complicated. And so there's no cookie cutter insurance. That's why for our office, we do a lot of homework for you before you have any procedures so that you know kind of any financial obligation per your insurance plan. We don't
Yeah,
decide those things. It's your insurance plan. But oftentimes patients assume, oh, it's covered. Yes, it's covered, but you owe a visit every time you come to me, you owe a copay, or you might have a deductible. And so we do a lot of education about insurance with our patients as well.
that's really good to know. Now, your path is amazing. You were RN, you're PA, and then you went to med school and interventional radiologist, and and now you're a practice owner. What kept you going through the 18 years of training?
I
Because
would
that's a lot.
say it is. What I always try to tell like my anybody that I'm on social media that I interact with, I try to well, I do. It's easy for me. Anything that I'm going to do is try to be supportive, encouraging to people. So because that's not really the experience that I had. Maybe that was partially me. Maybe that's because I'm a first generation to
Right.
go to college. But the thing that kind of kept me going was the thought of ever having to go back to the
Yeah.
circumstances sort of that I grew up with. I I did not ever want to go through that again. And so what I did was I was able to educate myself. So anytime there was something hard, if it was stressful, if it was a failure, if whatever it was, I just said, keep going because once every step that you take is going to keep you out of or potentially where you came from, which was, an uneducated, neither one of my parents, my mom didn't graduate from high school. It was a lot of like toxic cycles that I broke. And so I think that was it. Kept me out of trouble. And despite everything, I just kept going.
I love that. Kudos for
Mhm.
you.
Thank you.
Definitely.
Yeah.
Now,
Yeah.
if why was it important for you as a minority woman physician to own your own practice and control how your patients are treated?
Wow, this is a great question. I think because every time I've worked in a corporate environment, whether that was the nurse, PA, physician, in my training, etc., I found that I all of the oftentimes I was made to feel like the my thought process was like an anomaly or way outside the box.
Yeah,
And I knew if I could start my own practice and run it the way I felt like patients should be treated, whether that's figuratively speaking, how we interact with them,
yeah,
or literally speaking, doing procedures, I I would give them like VIP treatment because I didn't always feel like in all those years that I felt like there was more that patients could be given.
yeah,
And so by starting my own practice, honestly, I have been able to do that. I feel proud of my team
yeah.
who just embraces that. My patients love it. There's a certain, I mean, kind of patient that really gravitates to me.
Hmm.
Um, and I think that's a patient that wants to be informed and educated and have a decision about their care. But
Yeah,
yeah, I knew I had enough experience as a nurse, as a PA, that when I went into medical training, I definitely knew what patients wanted, which was time with their physician, quality time with their physician, and being educated about why they're having procedures or not, or what's going on, and then people who listen. And so once I thought about it, I was able to do it. I knew I had the skills. I knew I was smart enough. I put it all together and I saved some money and didn't take a loan and started my own practice. And it's the best decision I ever made. Like, I love what I do.
that is so amazing. And I'm so proud of
Yeah.
you. it's important, to be able to be a minority and be able to be a woman and to be able to be a successful businesswoman because you're not only, helping people as a doctor, but you're also running your practice and you really have to have knowledgeable business skills also. People don't realize that, but in order to be successful in your practice, you have to understand business also. So, understanding both sides of the boat, I guess. It's
Mhm.
really important factor, and I love that. And I think it's so important also. Nowadays I know in my state, you doctors don't spend more than 15 minutes with you. They're in and they're out, and a lot of it has to do with the laws rather than what the doctors really want to do. A lot of times, doctors are told they can only spend X amount of time, and they have to go to the next patient, then the next patient if they don't have their own practice. And let's say they're working in a clinic or a hospital. And
Yes.
so a lot of times, people don't get the treatment they want. And it's not very, it's not always easy to find a doctor who listens. And you can tell the ones who really listen and care versus the ones that are just there, and sadly,
Yes.
I've been in doctors' offices and I'm thinking to myself, why did they become a doctor?
I
And
know, right? Me too.
you
I
know,
didn't, and that's what I didn't want to become. I didn't aspire to be that.
yeah,
I want to be the physician where oftentimes, I mean, we have great Google reviews. There's a reason for that. Those patients
yeah,
aren't writing those reviews. Be there's, I mean, the praise that we get, it's unheard of almost. And I can't take full credit for it myself. It's my whole team. There's four of
right.
us, actually five if you include my bookkeeper, and she's a very important